Hi, Jason. My name's Hans. I'm going to be your nurse here in the emergency department today. So what has brought you in?
Um, my back started hurting about 2 days ago, and I think that the change in weather has triggered a sickle cell crisis. I've done everything I could to try to control the pain, but it just keeps getting worse. I was gonna go see the doctor, but lately, every time I move around, I've just been getting really short of breath,
Hmm.
and I just didn't think I could make it in.
Okay. So just a couple of questions for you then. When did this shortness of breath start to occur, and have you had any fever or discomfort in your chest?
The problems with my breathing started yesterday. I didn't get around much 2 days ago because of the pain in my back, but I noticed that yesterday, whenever I tried to go to the kitchen or the bathroom or anywhere, I had to stop short and try to catch my breath because the breathing had gotten so bad. I had a bit of a cough that night, but I didn't notice any fevers.
Hmm.
My chest is uncomfortable.
Okay, so I was looking at the vital signs that we collected earlier, and it looks like you do have a fever, and also your O2 levels are low. They're at about 91%, and that's concerning. So have you had any previous history of asthma or acute chest syndrome?
No, I've never had any problems like that. They just monitor my kidneys.
Okay. So when you're at home, are you ever on oxygen?
No, I don't use oxygen at home.
Okay, so what I'm going to do briefly is just listen to your lungs, okay?
Okay.
So I'm going to have you take a deep breath in and out. Another deep breath in and out. And now one more time. Okay, so I don't hear anything abnormal, but what I'm going to want to do is place you on some oxygen. So in just a second, I'm going to place a cannula over your nose because at 91%, that's a little bit low.
Okay.
And I'm going to also talk with the doctor and potentially get a chest x-ray.
Okay.
So let me put on the O2 for you. Okay, so we're going to put these on and just wrap them around your ears. Great.
Thank you.
So if you don't have any more questions, what I'm going to do is I'm going to go get the doctor and then discuss getting a chest x-ray. Does that sound good, Jason?
Yeah. How long do you think it'll be before I can get something for the pain?
So I'll also discuss that with her, and we'll be back in just a couple minutes then.
Thank you.
All right, great. Hi, Dr. Rogers. So we got a new patient in room 7. This is a sickle cell patient. He's come in complaining of shortness of breath. So upon further assessment, he's a little bit tachycardic, and he also has a fever. And on room air, his oxygen level was at 91%. So I put him on some oxygen, 2 liters per minute. At this time, though, he appears to be in no respiratory distress. And also important to note is 2 days ago, he had a pain episode. So other than having sickle cell, his doctor is following his kidney function.
Okay.
So as of right now, I have ordered some chest x-rays, but I was wondering what else we could potentially do, and he has also requested for pain medication.
Okay, thank you. So it seems like he might have an infection, but I'm also concerned about possibility of acute chest syndrome. So when their x-rays come back, I'll take a look at the labs, take a look at the x-ray and see what they say. I'm also concerned about the creatinine levels, so I'll take a look at that as well. In the meantime, for his pain, we're not going to give ibuprofen because in case the creatinine levels are too high. But what we can do is start him off on Dilaudid 2 milligrams because based on his chart, that's his starting dose for acute pain crisis. So we can do that and also get started for a PCA. Oh, when you get your, when you start the IV, if you could draw additional labs, so a CBC with diff, reticulocyte count, LDH, and go ahead and do a typing screen just in case we need a transfusion later.
Okay, great. So if it turns out that he does have a infection, is there any chance of him going home today?
No, it's not likely, especially with sickle cell patients that have additional oxygenation requirements. He has a fever, he has problems breathing, and he also has a cough. So I'm really concerned about acute chest syndrome. So in the meantime, I'll call this hematologist and talk to him when I get the lab results to see what he has to say.
Okay, great.